I just did a similar session with show ring kids. Were any of y'all in there for that? You were? Okay. So this will go a little bit farther, but it also has some of the repeat of what we talked about with the show ring kids. But, and I didn't bring this up with the kids. This coming change that's going to happen on January 1 of 2017, I think is one of the biggest changes we've seen in animal ag for quite a while, as far as our ability to how we're going to be able to use antibiotics, the requirements that we'll need to quickly get accustomed to using, especially for feed grade and water grade antibiotics. I think, well, and I know that when Denmark and the rest of the EU, well, really Denmark, but the rest of the EU too, about 10 to 15 years ago went through something real similar to this, where they pulled their growth promoting antibiotics, and they saw a proliferation of weaning in the nursery, or diarrhea in the nursery, scours through the nursery. So I think we're going to see, with the growth promoting antibiotics, yeah, we were promoting growth, but I think we're also going to see that we were preventing or controlling disease at the same time, and we're pretty quickly going to have to adapt our production methods to be able to deal with some of that, especially those nursery diseases that I think we're going to start seeing that we didn't know we were preventing with growth promoting uses. So we'll work through this. I'll explain to you what I'm talking about a little more in depth, but that's kind of a precursor for what we're going to talk about today. So this as an issue has grown. It seems like everything happens in Europe about 10 years, 15 years before it happens here. We saw that with welfare. We saw that especially with sow housing issues. This is another issue that really we've seen it grow in Europe and then start to gain traction here in the United States. And I think antibiotic resistance, the importance of antibiotics, it is a real issue, and it's one that we do need to take seriously. And I'm pretty proud to say, actually, that I work for the pork industry and for the pork board, because I think when it comes to dealing with this issue, we were doing it already before we were being told we had to deal with it. When you look at the history of pork quality assurance, PQA, going back to 1989, when you look at the producers that when I was in practice that I worked with and how they functioned today as well, the producers I know that have standard operating procedures and protocols in place for use of antibiotics, I think we've been addressing this. We just haven't maybe been documenting some of this as well. But I think we as an industry, when you start looking at us and cattle and dairy and poultry, I think we as an industry in the the pork industry are very well positioned right now to deal with this. We just need to make sure that we cross all our T's and dot all our I's, especially when it comes to record keeping, and I'll get into a little bit of that here. But it's a common consumer, a common customer question right now. You've got customers out there that are wanting to know, how do you use antibiotics? Why do you need to use antibiotics? Can't you stop using antibiotics? What happens when you stop using antibiotics? We want to be able to label this as no antibiotics ever product. We want to be able to label this as strictly a no antibiotics product, which I'm not sure what that means because we're not selling antibiotics in the product anyway. You hear from consumers and they're completely confused on the issue. There's some consumers that understand that it's a resistance issue, but there's even more consumers, I think, right now out there that see this as a residue issue. And we haven't had residues in the pork industry since, well, shortly after 1989. When we had pork quality assurance come out in 1989, we very quickly cleaned up our residue issues in our industry, which we did have in the 60s, 70s, and 80s, mainly with some of the sulfa drugs. But you just don't see residues, violative residues, in pork anymore. And it's because of the quality assurance, and it's because of the way our producers produce pigs. But consumers don't understand that. They think that it is something to do with antibiotics in the food. There's antibiotics in that meat case. And then you've got all the labeling that's going on, and you get labels that it's raised naturally, raised without antibiotics, no antibiotics ever, all that stuff. Well, then when they see that on a label, what does that mean for the stuff that's not labeled that? So that raises questions with consumers too, and leads to some of the further confusion over antibiotics in the meat. But this is a change that's happening for all of animal ag. It's also an issue for both human and animal medicine. Resistance is real, and I will tell you here right now today, if we stopped using all antibiotics for animal health, resistance would continue to develop. Okay? If we stopped using all antibiotics for human and animal health, so we're not using any antibiotics anywhere, resistance will continue to develop. It's natural. It was happening long before we ever started using antibiotics 100 years ago. So it's not something that we can stop. It is something that we can slow. It is something that to some degree we can control, and we can do that by making sure we're using the right antibiotics for the right indication, for the right amount of time, in the right amount, in the right dose. Okay? In other words, use them responsibly. But it is this has grown out of this One Health effort, and it's a collaborative effort between the animal health industry as well as the human health industry, and it is one that we do need to address, and it is one that we as the pork industry have a role in because we use antibiotics. Anybody that uses antibiotics has a role in this. Whether you're spraying it on your oranges, feeding it to your cattle, injecting it in your pigs, or using it on your kids for earaches, or whatever it may be, we all have a role in this. Because anytime you use antibiotics, you can contribute towards resistance. It's not a new issue, as I said, but we as pork producers, we as an industry, do have a role to play. And I think it's one that, to some degree, we've already been playing. We just haven't made that known. We haven't been documenting why we use antibiotics when we do. We haven't been documenting how we reduce the need. And that's what it's about, reduce the need to use antibiotics. We haven't been doing that, and that's something we're going to have to very quickly, as an industry, come around to, is actually documenting why and how we're using antibiotics so that we can show that we are, in fact, doing it responsibly. So what will these antibiotic changes... Do you have a question? There, a question? If there's any questions, too, stop me anytime. What will these antibiotic changes, or what are the antibiotic changes that are coming? First off, FDA regulates both animal and food animal and human medicine antibiotics. So it's the same agency, the Food and Drug Administration. They have the ultimate authority over the use of antibiotics in the feed, as far as a veterinary feed directive to be able to use those antibiotics. When you start talking about prescriptions and the use of prescriptions for water medications in pigs, which we'll get into here in a minute, that's actually governed by your state prescription board. So it varies from state to state. It is not an FDA function. So there's can be a little bit of confusion there. If you need information on your state information as far as FDA, VFD, veterinary feed directive, the veterinary client-patient relationship, or on your state pharmacy board, you can find it up at pork.org under your state name. So what we have today for antibiotic label claims is we can either use them for therapy, which is treatment for disease, control of disease, or prevention of disease. Those are all therapeutic uses of antibiotics. And as we stand here today, we can still use antibiotics for growth-promoting uses in pigs. But that's going to end for the human medically important antibiotics on January 1 of 2017. You will not be able to use human medically important antibiotics for growth-promoting or nutritional efficiency purposes on January 1 of 2017. You can't get a VFD to do it. You can't get a prescription to do it. You just can't do it with human medically important. You can still use those same antibiotics for therapy. So if you're using those antibiotics for treatment of disease, for control of disease in pigs, or prevention of disease in pigs, then you can use them. But on January 1 of 2017, you're going to need to do that with a veterinary feed directive, which is basically a prescription your veterinarian writes for you to use with feed-grade medications, human medically important feed-grade medications. There are a few exceptions to that, and I'm going to show you those here in a minute. But most of what we use has been deemed by FDA to be human medically important. What do they define as human medically important? Any antibiotic that we use in animals and humans both, that's medically important. So penicillin, it's a great example. We use it in humans and animals both. So it's human medically important. There are other antibiotics that we don't necessarily use that exact antibiotic in humans, but we use antibiotics from that same class in humans. Okay, so those are deemed to be human medically important because they're in the same antibiotic class. That's how FDA went through the list and determined what was human medically important. There's the list with animal feed medications of the few that would fall out of that would not be deemed to be human medically important. You can use those without a VFD if you're using for treatment. And if you were to use any of those for growth promotant, you can continue to use those for growth promotant uses. They're not deemed to be human medically important, but that's the list. That's it. Now, one that David brought up was avilamycin, which is the new Cavalt product, that's Elanco's product for treating scours, E. coli scours, and nursery pigs. That actually is not human medically important. It's been deemed to be not human medically important, but it's a new drug, just came on the market. FDA went ahead and said you got to have a VFD, a veterinary feed directive, to use it. So I'm not sure why they did that. Actually, Jennifer Coleman, who's our public health veterinarian that works primarily on this issue, she's got contacts at FDA that she's trying to make to find out if that's going to be the case for all. We don't get a lot of new drugs, but for any new drugs we get that are going to be applied in the feed, are we just going to make them VFD even if they're not medically important? We don't know the answer to that yet. But you do have to have a VFD for that one, even though it's not human medically important. So this has been in the news quite a bit for the last several years. This is a New York Times article from, I don't remember what, I think it was just a year or two ago, about antibiotics use in animal eggs, livestock. There was a lot of discussion on the total number of pounds or tons or volume that we were using, and the fact that you can hear all kinds of approximations. We use 70% of all antibiotics that we use in animals, and so on and so on. And that doesn't really mean that contributes more to resistance, but it did gain a lot of public attention. They don't have proven connections between using more pounds of an antibiotic and development of faster or more resistance. But the precautionary principle basically is if you're using a lot, then it must be bad, and we want you to use less. Now, I'm not going to tell you that what they're doing today with veterinary feed directive in feed grade medications and in water medications is going to cause us to use less. In fact, if you looked at Denmark and what happened to them 10 to 15 years ago when they dropped all their growth promoting uses, the actual tonnage of what they were using, or the volume of what they were using, went up because they were having to treat more disease. So we're working, and I'll talk to you a little bit about this later, but we're working with FDA, trying to get them to realize that it may not be, at least in the beginning, the most effective outcome to be measuring volume of usage. That may not be what you see as far as a drop in volume of usage, at least immediately, until we get some of these disease issues that we have been treating or preventing with growth promoting uses, until we get some of them under control. So January 1 of 2017, that's when all of this takes effect. That's when you no longer will be able to growth promote and feed with human medically important antibiotics, and that's when you'll need a VFD for therapy uses in feed of human medically important antibiotics, and that's when you'll need a script from your veterinarian to be able to use water medications for human medically important antibiotics. This all comes about from guidances 209 and 213, which are FDA guidances. Guidances are not rule, they're not regulation, but what they amount to is FDA saying, we think it'd be best if you did this. We think it'd be best if you not growth promote and feed anymore. And we think in fact, we think it'd be so good that in fact pharmaceutical companies in 209 and 213, we're going to ask you to change your labels so that you can no longer growth promote and feed with human medically important antibiotics. When that label changes, that makes it law. Even though this is resultant from a guidance, not true regulation, not true rules, even though it results from a guidance, when that label changes on that feed bag, then it's law. Because it is illegal to extra label feed grade medications. You have to follow the label. So once growth promotant as an indication comes off that label, you can't do it. So again, those there I've got anaphors back up there now. But there's again that list of antibiotics. They'll remain over the counter for use in feed and water, but that's a very short list. All other swine antibiotics used in feed and water will be affected by 209, 213. Okay, so 209, we said this, FDA intent was to remove growth-promoting uses of medically important antibiotics and increase veterinary oversight if you're going to use them therapeutically, and that's where the VFD comes in. And a veterinary feed directive is a script basically to use that feed medication with your pigs, and it requires that veterinarian to have knowledge of your pigs and your pig operation. Now that's a very general thing because that's a veterinary client-patient relationship is what that's called, or VCPR. You're going to hear a lot about VCPRs coming in the next 6 months. And VCPRs, there is a federal definition of what constitutes a veterinary client-patient relationship, but there's also state definitions. So what FDA has said is the federal definition is the baseline. You have to have what it says in the federal definition to help to say you have a veterinary client-patient relationship. But states, if you want to say something more about what constitutes a veterinary client-patient relationship, you can, and they will have to abide by that in your state as well. So again, at pork.org, if you go up there, there's a click on that you can get to for veterinary client-patient relationship, or VCPR, and it will tell you in your state what the requirement is so that you have a VCPR. Your vet will need to have that VCPR with you, with your operation, so that he can write you that veterinary feed directive when you need to use feed-grade medications. And like I said, this is a request to the pharmaceutical companies to remove it from the label, and that makes it law. All the animal health companies have agreed. It's been a 3-year process, but they've all agreed. You're going to start to see transition labels, I think, in May or June. Through this process, I found out that there's only two entities in the whole country that print those feed bags. So when you go changing labels on all the feed-grade medications, that's a lot of reprinting, a lot of changing of labels that has to occur, and there's only 2 entities that do it. They're not going to be able to keep up. So what the pharmaceutical companies are saying they're going to do is they're going to have transition labels. And here this summer, you're going to start to see labels on your feed-grade medications that say, up until January 1 of 2017, you can use this as you have in the past. Growth-promoting uses, no need for a VFD. Once January 1 of 2017 hits, once that clock strikes midnight on December 31st, then no longer can you do that, and we will transition to this other label that will be on this sticker that will say no growth-promoting uses for human feed-grade medications, human medically important, as well as the need for a VFD if you're going to use it therapeutically in livestock. So you're going to start to see those this summer. And then what they also, at the same time, FDA, we've had VFD. We've had Palmitil since the late 90s. We've had VFD drugs. Our industry actually, again, is a little bit ahead on this because the cattle industry is not used to using VFDs, but we have. We've had a couple of feed-grade VFDs that we've had since the late 90s, Palmitil being one of them. So we know what a VFD is. Our vets know how to fill it out. We know that we have to keep it on record. We know we've got to get one to be able to get the medication put into the feed. So we're a little bit ahead of the game. Cattle guys, not so much. They haven't had VFD drugs in the past, so it's going to be a whole new learning process. But FDA at the same time said, well, the VFD rule is now almost 20 years old. Let's go take a look at it and see what we want to change. And so they did make some changes to the VFD rule. And I'll get into that here. I think maybe it's the next slide, or a slide or two later that we'll get into. So we've already talked about that. As I said, I think this is a very significant change for our industry. It's going to change how we use antimicrobials in our pigs. We talked about the legality of the label and the use of the VFD. And we may actually see some antibiotics out there that when you take away their growth-promoting uses, their company or their sponsor may say, you know what, we don't think we're going to make enough money on this as a therapy drug. So we actually may see, I don't know this to be true in any cases yet, but we may see some folks that say, all right, we're stopping with that drug. We're not going to relabel it, we're just not going to make it. So I don't know of anything like that happening yet. I haven't heard even any inclination that that may happen yet. But it's something that could happen. It may not be worth their while if all it's going to be sold for is for therapeutic uses. We'll have to see how that shakes out. This new FDA rule, what it's going to amount to for us, it's going to amount for us and our veterinarians and our feed mills more time putting together our feed. We're going to have to plan it out ahead of time. We're going to have to make sure we've got that veterinary client-patient relationship in place. We're going to have to make sure we have all that paperwork in place. And we're going to have to make sure we keep that paperwork for a period of years after we use that drug in our barns or in our swine. So, and I'll get into that here in a minute on the requirements for retention of paperwork. But it does require retention of paperwork by all three entities. All three entities will end up with VFDs. Producer, feed mill, and vet all will have a copy of the VFD, and they will need to keep it on file. Another concern that we have, and I was talking with some before everybody came in the room today, is we may have some areas where we don't have a lot of veterinary coverage. In fact, we are getting some of those questions already from states like, I got one last week from Washington that said, hey, well, Washington State, how can I do this? I don't have a vet close. He can't just run out here and write me a VFD. In fact, I don't have a vet in the state that I know of that works on swine. We've had that question from Colorado. We've gotten it from other states where you don't have as many swine vets as we do here in the Midwest or in North Carolina. So there may be some veterinary access issues. There may be, in fact, we've been working with AASV, the American Association of Swine Veterinarians, as well as with AVMA, the American Veterinary Medical Association that represents all veterinarians, trying to find those spots in those states that are veterinary sparse, or at least swine veterinary sparse, for where folks are willing to either learn about swine or have in the past known about swine and are now willing to work on them, or at least consult on them so they could do a VFD for folks that need it. But this could be a real issue for states beyond the Midwest here and North Carolina, is being able to find a vet to actually willing to come out and establish that relationship with you and your system and how you raise pigs, and then write you a VFD. So we may see some of those issues. One thing we're doing at the pork board is we've had discussions with the American Association of Swine Veterinarians on putting together a vet finder. And I think it's going to work with them, where veterinarians that are willing from the AASV to be located will be on this map. You can type in your zip code, and you can find out who's close if you need to find a veterinarian. That's through AASV. We're going to propose a similar type of project with AVMA, the American Veterinary Medical Association. We'll see where that goes. But that would help us further find some of those mixed animal practitioners that are willing to see swine, or at least learn about swine and then see swine. So in the future we can use them to be able to develop that relationship, and also to write the VFD for those that need it. So one of the things, if you stop by our booth, that you'll see today is that fact sheet. That's a pretty in-depth look at what the regulations are that are changing, how they're changing, and how they will affect producers. There's a shorter one that I think is actually a little better even, that I don't have a picture of up here. It's just fresh off the press, a little more succinct in getting to what these changes mean to you as a producer and when they're going to happen. So if you'd stop by the booth and grab both of those, I think it would help you out with this. Of course, pork.org, we've got a whole section now on antibiotics. If you go up to pork.org, in the hot topics, you'll see an icon of a medicine bottle with a red cross on it. You hit that, and that'll take you to all the resources we've got, and those are updated all the time as we get new information. As we start to see new transition labels, we'll be updating it then. We just, in fact, last week instituted a new blue ribbon panel to take a look at what we're doing as an industry to deal with antibiotics and to more responsibly use antibiotics, reduce our need for antibiotics. And so some of that information is going to get up there here shortly that came out of that meeting. So I do encourage you to go up there often and take a look. As we go through this year, you can see some of the changes that are happening and get more assistance with this as we come down to 2017. We already talked about the VFD and record keeping, and they have to be kept by all three entities for 2 years. Now, the previous VFD rule is on the left there. The revised rules on the right, as it came out last summer. It didn't change the retention level. It still was a 2-year record of retention. They are allowing for electronic copy of these VFDs. So it doesn't have to be a paper copy. It can be an electronic VFD document. As I said, there's no extra label use ever with feed-grade antibiotics. The order is written for a number of days, not for a number of tons of feed. So you'll need to figure out how long does your veterinarian want to treat in the feed, and then figure out how long you're going to need to have that for a number of days. VFDs are not refillable. At least as we stand here today, they're not refillable. None of the labels have any refill claims on them. We don't expect that we'll see a change towards a refill claim, and if we don't, then VFDs are not refillable. At least that's been the point at this point from FDA. You've got to attach a list of premises that this feed's going to go to if there's multiple premises. That's especially important at the feed mill. I talked about the state definition of a veterinary client-patient relationship, and the max amount of time, the max expiration date on a VFD is 6 months. And that doesn't mean that it'll all be written for 6 months. In fact, I expect they won't be written, all of them be written for 6 months. They'll be written for a certain therapy length of time. But what that means too, though, is when that VFD expires, because it's not refillable, if you are still feeding the medicated feed, either in your feeder or in your bin, feeding it anywhere to pigs, then you are in violation of FDA. So you got to make sure that if you're going to be feeding it, that you've got a VFD that covers it. And if you've got a VFD that's going to run out, then you need to get another VFD before it runs out for that feed that you've got remaining. Okay? So it's not, this isn't just like a prescription where we can go to a pharmacy for our kids and get a prescription filled out, and then we use it, hopefully we use it for the whole length of therapy, and we use everything up in the bottle, and we use it in 10 days or whatever it gets prescribed for. This is not like that. This is a VFD that's written for a period of time for you to be able to feed this feed. And if you go beyond that period of time, beyond that max expiration date on that VFD, you are out of compliance. Okay? So, you know, I hear about the days when chloramphenicol came off. We could no longer use chloramphenicol in animals. John, do you remember when we could? Put you on the spot. I became a veterinarian after that, but I worked for veterinarians that said, oh yeah, before chloramphenicol went off the market, that whole back room was full of chloramphenicol because I knew they were taking it off the market, and I was going to stock it up, and I was going to have it for 2 years afterwards. You know, this is a different situation. I don't think, well, there's no antibiotics being taken away. There may be some antibiotics that go away because they don't change the label, but it's not a stock-up situation. That doesn't help you at all. Okay? So if you want to use whatever you're using for growth hormone, it's not a stock-up situation. That drug is not going away. There's no reason. You shouldn't do it anyway, but there's no reason for you to try to hoard it ahead of time. It's a different situation than when a drug gets taken away. Take-home message really with VFD is establish that veterinary client-patient relationship right now if you don't have it. Probably everybody in this room, that's singing to the choir. You've already got it. You're here in Missouri where we've got plenty of swine veterinarians. You've already got that relationship established. But now go back home and ask them what their plans are as we move towards 2017. Make sure they understand what's changing. Maybe you can educate them a little bit even on what's changing with feed grade and water grade medications. That's really that point. Record keeping. Record keeping is going to become a big part of this, and that's where FDA is going to go when they come to visit farms, or they go to visit feed mills, more likely, or they go to visit veterinary clinics. They're going to ask to see records. They're going to want to see that VFD. They're going to see past VFDs held for 2 years. So we're going to have to become better at record keeping. Pork Quality Assurance Plus has all the records, example records, and the description of how to keep those records that you need to stay in compliance with FDA guidance. So I encourage you to take a look at that. We'll have a new PQA Plus coming out here in June at World Pork Expo. It'll be the revised version, but the current version has all the records you need as well. So I I would say don't wait until January of next year to start keeping your records. I would start practicing now so you've got records in place and you're ready to go come January. And records can be hard copy or electronic copy. So your checklist, or what you need to do to make sure that you don't have issues with this going forward, is you need to understand what the veterinary feed directive is. Hopefully I've gotten to that today. Understand what a prescription is for water medications. If you don't have a good veterinary client-patient relationship, work now to get one established before January gets here. Because in January I think there's going to be a lot of scrambling for some of these feed-grade medications. Communicate with your feed mill. Ask them what their plan is for VFD and record keeping. Make sure they're aware of this. If they're not, direct them to materials that will help them become aware of this. Take a look at your herd health. How can we reduce the need for use of any antibiotics, no matter whether they're water, feed, injectable, whatever they are? Is there a way we can reduce that need? Start to look at how you've used growth promotants in the past, and now that you're not going to be able to use that, and try to determine where you're going to have issues, maybe animal health-wise, and be more prepared for that as we pull those growth promotants out of the feed. And as I said, record keeping is a big part of this. We all need to get on board with record keeping. So there's that icon that I talked about on our website at pork.org. That'll get you to the resource center on antibiotics. There's all kinds of information up there now, and it's changing actually weekly as we learn more from FDA. So one thing the board did in June was address antibiotics as an issue within the industry and antibiotic resistance. And they wanted to come out with a position statement and a policy statement as well on where we're at as an industry with antibiotics. And I just wanted to run through a little bit of the language with you on that. This was some of the actual language that the board has in this document. They acknowledge that antibiotics need to be used responsibly, and they're important for both human and animal health. It's important to have them available now for both human and animal health. It's important in the future to have them available and working for both human and animal health. Preventing disease is always a better goal than having to treat disease. That's a statement there that we were delivering to FDA. Because once feed grade growth promoting use is gone with some of these antibiotics, or actually now that it already has been announced that it'll be gone, there's a number out there in the public that would say, well, why do you allow them to use it for control? Why do you allow it to use for prevention? Shouldn't it just be for treatment? Well, we all know it's better to prevent disease than to have to come back and treat it. And in fact, you're likely to use less in prevention than you will in treatment. And you're going to have less animal welfare issues. You're going to have less food safety issues. So the board wanted to get that message out there. Yes, you're taking away growth promoting uses. And yes, that may in fact be the right thing to do for responsible use of antibiotics. But to look at prevention or control would not be the right thing to do for both human and animal health. We want to acknowledge that we as an industry do want to protect the use of antibiotics. We want to protect it for the use of human health, and we also want to protect it for the use of animal health. It is a tool that we use as we raise pigs, as we raise cattle, as we raise sheep, as we raise poultry, whatever it may be. It's a tool we use. It's a tool we need to have. Don't take that tool away. Allow us to use it responsibly. But at the same time, we need to take a look at our industry too and say, are there ways that we can reduce the need to use that tool? Are there things we can do to make sure we don't have to use as much as we do now? I think there probably is. I think some of it's biosecurity. Some of it may be vaccinations. Some of it may be alternatives to antibiotics. Some of it may be fine-tuning some of our barns. But I think there are ways to reduce need, and we need to address that as an industry as well. We wanted to address, too, that we as an industry are doing research into some of those things I just talked about as far as reducing need and looking at vaccinations, looking at alternatives. We're doing that. We support the use of a veterinarian on farm, use of veterinary knowledge, use of veterinary diagnostics, use of veterinary advice for antibiotic usage. We also support the American Association of Judicious Use Guidelines. They have put those out to their swine veterinarians on how to more responsibly use antibiotics. We want to demonstrate compliance, and we can do that through PQA+, especially the record keeping through PQA+, And we want to encourage transparency within our industry. We don't have anything to hide. We're going to do this right. We're going to use antibiotics when we need to, but we're only going to use as much as we need to. We're not going to use them injudiciously. We're going to do our part in this whole overall equation for One Health. So our policy, as you boil it down, is use them responsibly, prevent disease when you can, protect the efficacy for both human and animal health, and reduce the need where we can. We've also put together a stewardship plan. It's a 3-point plan with education, research, and then communication. The education, we're going to partner with others in the industry, like American Association of Swine Veterinarians and others, in getting this message out. We want to make sure our producers know what is happening with these regulations. We want to make sure our producers stay in compliance and do not end up in trouble over this. And so we're partnering with feed mills, partnering with National Swine Registry, partnering with extension educators, universities, all these different partners to make sure we can deliver this message in all ways possible so that all producers know what is changing, know what needs to happen come January 1 of 2017 so they don't end up out of compliance with FDA. We've also, our board put forward extra funds last year to be used in this year of 2016 for research. We just did fund research proposals, came to right around $700,000 worth of research proposals funded just on antibiotic resistance. It is a priority for us. We also funded those early because usually we don't fund until this month and then actually start the projects in May. We wanted to get them started now. We need some more answers now on antibiotics. And I'll show you here in a minute some of those priority areas for that research. And then we want to communicate with you guys. We want to make sure you guys know what's going on, that you have all the information you need to stay out of trouble. So there's that extra allocation of funds towards that communication as well as research that happened by the board last June. Now the research priorities. As I said, one area that may come under attack, and actually already is starting to come under attack by some, is that preventative use, which is a therapeutic use of antibiotics. We need that preventative use of antibiotics. We need to be able to prevent disease in our pigs. So we're looking at research that would back up why that prevention use is a good thing. It is a responsible use. It actually results in less usage if you can prevent disease. So we're looking at projects based on that. Also, population treatment. In some circles, population treatment comes under attack. Why do you do that? Why do you treat everything in the barn? Why don't you just treat the sick ones? Well, there's a tipping point there. There's a point where you can individually treat, and there's a tipping point where it's a lot better off to treat the population than to continue to try to catch those, again, that already have the disease. It goes back to prevention of disease. So we're looking at research, looking at that population treatment, and what that does as far as reducing usage, reducing need for antibiotics. Also optimizing swine health. PQA Plus, we get verification results from PQA Plus. We've gotten them for the last 4 years. Each year when we get the verification data, it shows that in most cases we do very well in all areas on PQA Plus as far as actually implementing PQA Plus on the farm. The one area that started out, at least 4 years ago, below 50% was record keeping. And it's steadily risen over 4 years. It went, I think it was 49%, up to 70, up to 74. But I don't even know last year what it was as far as compliance with record keeping for on farm. So we need to figure out how we can help you guys better be able to keep records, because we're going to need to keep records on antimicrobial usage. Another question that comes up out there in the public is what happens to the metabolites, or what happens to antibiotics that end up in the pit, or what happens to antibiotics that end up in the pit that get spread on the field? What happens when it passes through the animal, and where does it go then? So we want to look at some research. We want to be able to look at good practices as far as dealing with antibiotics in the environment that can come out of some of our barns, and what happens to those antibiotics. And then one other thing, the last research priority was looking at ways to minimize our need for antibiotics. What are some of those alternatives? What is it we're not doing right now, either vaccination-wise, biosecurity-wise, whatever it may be, that we can use to improve health in our barns and thus less likely have to need antibiotics? Now, I mentioned earlier that FDA, one of the things they're looking at is how do we measure response to 209, 213? And FDA has been stuck on measuring volume. How much tonnage, how many pounds are you using? That's not going to probably be a very good measure. So we've actually contracted with Dr. Peter Davies, who's a university professor at the University of Minnesota. We've got him for a year. He went on sabbatical, and he's working on this for us. What are the proper metrics for FDA to measure as far as to see a response to 209 and 213 on the farm? And how do we deliver that message to FDA? That's his main project while he's on sabbatical with us. And I know that Peter's got some ideas that I've seen him talk about already, but we're not ready yet to deliver any ideas to FDA. But we're going to need to pretty soon. So we're excited to have Peter on board working for us for the full year. Other expert input that we've got, I mentioned Jennifer Coleman earlier. She's a public health veterinarian. And actually, she's speaking at AVMA on this topic today, or you probably would have had her here today. So she gets called out many times to speak on behalf of the pork industry on this issue. She does a very good job. She's also got a great background through the University of Minnesota on antimicrobials and also on public health as far as it pertains to the pork industry. So we've got her. You've got a committee, the Producer Public Health Workplace Safety Committee, works on this issue, funds the research, prioritizes the research for this area. Very good committee that has a number of advisors on it, like Peter Davies, like Morgan Scott, who's another professor that works in this area, like Mike Apley, who's another professor from Kansas State that works in this area. So we're getting good advice for the industry on which direction we should go with some of our research and also with other issues for antibiotics. We've got topical working groups that have been working on this. We've just coming out of having a PQA working group that revised PQA that will come out in May or in June at World Pork Expo. We've got a standing working group on antibiotics that includes a lot of those experts that I've talked about earlier. And then we've had other task forces in the past, and as we need them, we'll develop them too to address this issue. And then one thing that just happened, that just started last week, was we have a blue ribbon panel of really, for the most part, pork industry outside folks. We've asked them to take a look at what the pork industry is doing. This is part of that transparency effort. We delivered to them last week everything we're doing with you guys, trying to educate and also trying to show that what we're doing already, we've already really instituted a lot of what FDA is trying to do. We don't use antibiotics when we don't need to. We use them responsibly. We delivered a lot of that information to this blue ribbon panel last week. We've told them of our future plans as far as research and communications in this effort on antibiotic resistance and antibiotic usage. And then we sent them away with with homework, really, that was go take a look at what we've given you and tell us where we're right and tell us where we're wrong. We're willing to take that feedback. We want to take that feedback to make sure we're doing the right thing as an industry. These are folks like a former administrator from FSIS, Bonnie Bontaine, Dr. Steve Solomon, who's actually a medical doctor, used to be the head of CDC's Center on Antibiotic Resistance and now is a contractor on his own. He's on there. So these are folks with knowledge of the issue, but they're not really pork industry insiders. So they can take a look from the outside and give us some advice and some critique, really, on what we're doing. So we just started that blue ribbon panel here last week. So in summary, need to be ready for 2017. January 1 of 2017 is when growth-promoting uses of human medically important antibiotics will go away. And it's when we'll need to have a VFD to use therapeutic uses of human medically important antibiotics in feed. And it's when we'll need to start having prescriptions if we're going to use water medications for therapeutics. And as I said, there's that pork.org website. You'll also see quite a few of these in some of the journals and magazines. And a lot of the trade shows, we've had a clock, actually, that counts down the time to January 1 of 2017. Just trying to get that message to producers that things are going to change really pretty drastically with how we use antibiotics for the industry come January 1 of 2017. And we want everybody to be ready. Ready so that pig health doesn't suffer, but also ready so that they don't go out of compliance with FDA and end up in trouble.
I'm a high school ag teacher, so at some point in time I'll be part of the channel of transferring this information to end users, to kids. And they're going to ask why. The parents are going to ask why. Has there ever, I guess I believe that if we follow a label days of withdrawal, label restrictions appropriately. Is this an admission that the meat industry hasn't done that well over the years?
Not at all. No, that's a completely different issue, and that's some of what you can help with. There's a whole majority of consumers out there that confuse this with residues, which is antibiotics in meat, versus resistance. This does not have anything to do with residues. This is not about antibiotics in meat. In the 60s, 70s, and 80s, we had residues, a lot of sulfa actually, residues in pork. I mean, it was an issue. PQA, the first PQA came on board in 1989 as an educational vehicle to deliver information to producers on why that withdrawal period is important and how to keep residues out of meat. And it's been very successful. If you look now at the FSIS data, FSIS has a hard time finding violative residues in pork or really any of the meats, because now we got BQA and others. We've all got our quality assurance programs. Those have dealt with residues. So the days of overdosing and not following withdrawal, those are gone. And you're really not finding antibiotics in meat in a violative residue. What this is about resistance. And resistance really you don't have to, I mean, it's not a food issue. Resistance, if you've got, let's take a salmonella, for example. You got salmonella in your pigs on the farm. You treat them with an antibiotic, which is usually not a really good idea anyway. You treat it with an antibiotic. There's going to be some of that salmonella may in fact succumb to that antibiotic, but there's going to be some that are resistant. When you do that, you're selecting for those resistant bugs. Okay, you're giving them the whole gut then, basically, as a playground, full of nutrients and an area to conquer and to flourish. So the resistant bug flourishes, the non-resistant bug dies because you treated them. Okay. Now that may be that resistant bug may flourish, but you may not see the disease. Maybe you took care of the disease because you got a lot of the population that was non-resistant, but now you've got more resistant bugs. Okay, so those bugs can go to the environment. They can go to the kid who's playing out near the farmyard onto his hand. They can go any number of ways to find a way to a human. So it's not a meat issue there. So that's one way that resistance can flourish, not a meat issue. There's also what they call, and this is really in depth, and it's going to go too far, but these bugs can share what they call resistant cassettes. So in the old days, most of you in here can still, not you guys, but can still remember cassettes, basically a music cassette, and it was something you could trade with your friends, right? You could trade music with your friends by giving them this cassette you just bought. I think it's great, listen to this. Okay, well that's kind of the same thing with bacteria. Bacteria, that salmonella, not all bugs can do this, but some bugs, but that salmonella can develop resistance on a cassette. And then that cassette, it's like a piece of DNA that bacteria, that salmonella, can share with maybe the E. coli that's next door. It's next door in the gut. And that cassette can go from that salmonella to that E. coli, and now you've got that resistance to whatever it was, gentamicin, whatever it is, has moved to that E. coli on a cassette. So it didn't even have anything to do with being salmonella. It had to do with the cassette. Now, it doesn't happen all the time, but they have proven through research that resistance can move that way. The point with antibiotics is this. Anytime you use an antibiotic, you can be selecting for resistance if there are resistant bugs there. That doesn't matter if you're treating a pig, treating a kid, spraying it on the oranges. Wherever that antibiotic may be being used, you can be selecting for resistance. Resistance has been selected for centuries. We didn't discover penicillin until 1928, and that was Fleming didn't. That was the very first antibiotic discovered. So we haven't even had antibiotics for 100 years yet. But for thousands of years before that, resistance was already proliferating and developing. Because where do these antibiotics come from? They're natural substances that are made by other bacteria and fungi in the battle in nature to give them a leg up. So we already had them out there for eons, since the beginning of time, since the beginning of bacteria. We've had antibiotics out there because they were producing their own. So resistance was already rolling along for eons. Now, when we go to use them in anything, we can be selecting for further resistance. And that's why we need to make sure, whether we're a human medical doctor, a veterinary medical doctor, somebody that grows fruit, we need to make sure that we're using them responsibly and only when we need to, and then only for as long as we need to.